You are about to enter another dimension, a dimension where things can go very right or very wrong. You unlock this dimension with one of two keys. Key 1, evading responsibility, or Key 2, taking accountability. You're moving into a land of confusion or clarity, of blame or solutions. You've just crossed over into the Optum Zone. In this episode, you'll see what happens when members of a team divert responsibility and ownership to everyone but themselves.
Good morning, Dr. Frankenstein.
That's Frankenstein.
I'm sorry, doctor. I stand corrected. I'm Emma, your provider service rep. I'm here today to discuss these AHA forms with you. After we've gone through these with our coding specialist, we see that there are several changes that could better clarify the story to help explain these patients' needs.
I need to see patients. I went to a top medical school to learn how to care for patients. Whoop, whoop. Not to fill out these forms.
Yes, I understand how precious your time is, doctor. I would just like to take a few minutes
I really don't have time to talk about risk whatsoever. I can give you 5 minutes to say what you think I don't already know. I have patients waiting on me as we speak. Let's go.
Okay, fine. So let's just take a look at these HCC reports that I have. And I also brought along some previous AHAs.
When did we start doing this? I don't remember having to do this last year. Bobby, did we have to do this last year?
I filled out something and faxed it in last year. They keep adding more requirements every year. You should stop taking Medicare patients.
Let's just take a look at this report. It shows patient Mary T. Reck has these dropped HCC scores.
This cannot be accurate. This is not even my patient. This is my partner's patient. Bobby, who sees Mrs. Reck?
She's Dr. Igor's patient.
This is our lovely president's fault. This is all part of that socialized medicine nonsense. I'm working for free here. I can't even pay my staff. Bobby, did you get a bonus last year?
Hell no, if it wasn't for drugs reps, I could hardly eat.
Is it 5 o'clock somewhere? Well, whoever saw the patient is going to need to complete the documentation. CMS doesn't know anything unless it's written in the medical record. So this year, on paper, Mary started out as a healthy patient.
Our fine government at work. Mary's records are probably lost with the rest of the IRS emails.
I love the color of your walls. Is that your kid? He's very handsome. Oh, Carrie, let me introduce you to our coder, Carrie. She's here to help with the documentation. Carrie, Dr. Frankenstein.
I'm Dr. Frankenstein.
Hello, Carrie. Please have a seat.
Doctor, you coded what you saw on her visit this year, but each year documentation needs to reflect previous history. So if we look at a side-by-side comparison, good, better, and best coding, this is how Mary information appears.
There will be a new president, so why bother? This will all go away. I've been through this a million times.
So I'll have our medical director, Dr. Fine, call you. He's really excited about this. He used to live next to the president. I know you're busy and have other things to do right now, but can I just leave these with you so you can make the appropriate attestations and whatnot? I'll need them back within 15 days in order for you to get reimbursed. Oh, that's my mother calling. And she's using my middle name. We gotta go.
Fine.
Here's what it looks like in a dimension where people take ownership and are accountable for their actions.
Good afternoon, Dr. Frankenstein. I'm Emma.
Good afternoon.
Thank you for allowing me the time to meet with you today. I'm here from the medical management company to talk to you about Medicare risk adjustment and the importance of accurate documentation. I would also like to start working with you and your staff on scheduling appointments for members who need their annual visits. Our care coordinators at our home office have begun contacting members to schedule their visits within 60 days of their enrollment for their annual visits.
Good. I was looking at this dropped HCC report, which came with my eligibility list from you guys. And it doesn't seem to be accurate.
How so?
It's showing my patient Mary T. Reck as a healthy tennis-playing senior, but I know for a fact that she is on oxygen and is an amputee. This cannot be accurate. Her RAF score must be higher than this.
I agree, and that's what I'm here to talk to you about. Let's take a look at the HCC report. And I also brought along some previously submitted AHA that include Mary's actual AHA that we can review.
I get concerned sometimes when I see something that is counterintuitive on a report. Show me what you brought.
We worked with our coding service, and we see that there are several changes that could better clarify the story to help explain this patient's needs. For instance, it says here that Mary has COPD and had her right leg amputated.
Come on now, CMS must know that it did not grow back.
CMS doesn't know anything that's not documented in the medical record. Each year the slate is wiped clean and the process starts over again. So this year, on paper, Mary is a healthy new patient. Did you know an amputated leg is better than an amputated arm?
Come on, it's crazy that we have to tear through so much red tape just to get reimbursed fairly. Here I'm trying to be efficient and effective, and I'm asked over and over again to do this unnecessary paperwork by payers.
Oh, let me introduce you to our coder, Carrie. She's here to help you with your documentation.
Hello,
Carrie, we were just going over this report for this member's drop HCC report.
Oh, Mrs. Rickchaw, this is a good example for us to go through. You coded what you saw on her visit this year, but to reflect her true health status, we need to reflect previous history.
And why do we need to have her history repeated every year on paperwork for CMS? Can't they see that this repetition of all this paperwork is just wasteful?
Excuse me, hey Vic, you want to go to the driving range with me?
I would love to, but these ladies have so much paperwork for me to do.
Well, then I better get out of here because I don't want to get hoodwinked into doing the same thing.
As I was saying, this is how CMS builds the member RAF score, and the RAF score determines the amount of funding that will be provided to you so that you can deliver quality care for this patient. So if we look at this side-by-side comparison, good, better, and best coding, this is how Mary information appears.
I want to get these changes out of the way right now. I want to understand and correct the mistakes that I've been making.
Doctor, it's not a matter of making mistakes. It's simply there are tens of thousands of codes that could possibly use to tell a story. And in the moment, it's hard to know the exact right ones to use. That's where we come in. We are scrubbing the data for you and then coming back to assist with opportunities to help you for improvement. We are also able to see additional information from our records that you may not have when completing your AHA form.
This information includes medication the patient might have had prescribed from other physicians, procedures that might have been conducted, the things of that nature.
Wait a minute. If you have all this information, why don't you just do it for me?
Ultimately, you as the doctor need to attest the correct information. We want to work with you as specific as possible when coding conditions.
Fine. I assume you want me to make sure that the medical record contains the information that supports what we code, right?
Absolutely.
Oh, doctor, if only everyone in your profession was as wonderful as you, all our members will have appropriate RAF scores.
Wonderful. Thank you. Thank you.
You're welcome.
You've seen two very different conclusions where the biggest variable is accountability. Which dimension would you rather live in?
Action.
Good afternoon, Dr. Wallace. I'm Emma.
Dr.
Oh,
I filled out something and faxed it over this year. Sorry, last year.
This is our lovely president's fault. I'm sorry. Bobby, when was the last time
No.
you got...
Bobby, did you get a bonus last
Sorry.
year?
Bobby, when was the last... Bobby, did you get a bonus last year?
Hell no. Wait a minute.
Whoop, whoop.
Supports what we code, right?
absolutely. Oh, doctor. Hello.
Absolutely. Oh, doctor, if only everyone in your profession,
If everyone in your profession were as wonderful as you, wonderful as
you are. All our members.
Take it.
It's like a Chinese karate movie.
I have a new respect for actors. Okay.